can you give us an example of, the most common things that people come to you to help them with subliminal therapy?
Well, that seems to vary over time. Presently, the most popular or most common problem I'm seeing is that of chronic pain.
Chronic pain, okay.
Turns out a lot of chronic pain is not functional, it's not necessary, it is psychogenic. In other words, it's being created in the person's mind.
Psychosomatic, yeah?
Yeah, well, okay. And is, to the extent that it is psychogenic, it can be corrected, it can be eliminated.
Okay.
Before that, I was seeing many cases of trauma-related problems.
Like PTSD and things of that order, or?
Yes, especially PTSD. I haven't had the opportunity to work with many war veterans who were suffering from it. I look forward to that opportunity, but it hasn't happened yet.
Mm-hmm.
The same phenomena happens to others. And any situation of severe trauma, there apt to be an influence that goes forward.
When you say trauma, you refer to emotional trauma, basically, yeah?
The emotion is the key. It can be also physical, of course. It could be rape or physical attack, but the emotional factor is the factor that causes the continuation of that influence, and it can be lifelong.
I understand. And do you now still see clients that you work with, or you're just teaching?
Oh, I have a small practice. I see, I'm probably treating in my office somewhere 10, 15 hours a week.
Okay. And what is the success rate you have with subliminal therapy versus other methods that you used before you used subliminal therapy?
I want to give you two answers to that. One of them doesn't really count, but that is my personal impression of what happened. Unfortunately, it was not until 2008 that I began to document these success rates.
Yeah.
Doing so by a brief inventory that I ask the patients to complete before treatment, after treatment, and then with follow-up anytime it's possible. And the results of this collection of data that continues even now, these results are posted on the website, my personal website, and on the Institute's website.
Yeah. And we'll also take them and translate them into Romanian, so we'll make them available also for public here.
Wonderful. The rates far exceed any other therapy that I know I've ever heard of.
Okay.
Far. Okay, the varying rates, oddly enough, big surprise to me, the highest rates seem to be in the field of addiction.
Addiction.
Yeah. Chemical addiction and social addiction, but in the field of addiction.
Okay, so when you say addictions, you mean like drugs, alcohol, cigarettes, or other kinds of addictions, or?
All kinds. Addiction to people, gambling, and drugs, yes.
And so, is there like an average that you discovered, that like an average number of sessions that you discover you need to come to a conclusion, to come to a resolution with a client?
Yes, and that data also is posted on
Can you tell us now?
This is brief therapy. It's the briefest of brief therapy.
Mm-hmm.
I rarely see people, overall, I rarely see people for more than 5 or 6 sessions.
Wow. So your
But,
average would be 3 or 4?
yeah, it's probably overall in that order.
Okay.
There are exceptions.
Oh, always.
Especially the eating disorders seem to require ongoing, periodic search for prompts that are caught continue.
Okay.
Eat properly for some time and then find themselves
relaxing,
back, as they see it, back in the old track.
Mm-hmm.
So it's a matter of perseverance.
Of course.
But most disorders are briefly handled.
And can people do this by themselves? I mean, can people use self-subliminal therapy?
Well, you can certainly learn how to communicate with that higher level of intelligence that you have. Mm-hmm. That you can do. And we don't make very good self-therapists.
Uh-huh.
I think the problem is we can't really be objective about ourselves.
Yeah.
And so if the problem is going to require objectivity, we're very limited.
Mm-hmm. Okay, so because there are a lot of people who are interested also, like I said, in learning the method, and they're curious if they can do this, if they can use this method to use by themselves, for themselves in the future, and how effective would that be?
I don't have any measure of that.
Mm-hmm. Okay, because like they say, you can do hypnosis and then you can do self-hypnosis, and
well, when you say you can do hypnosis, you can go into trance.
Mm-hmm.
That doesn't mean anything. There's nothing to that. The value of hypnosis lies in understanding how to utilize that skill.
Of course, yes.
So I think the same thing applies if you're using hypnosis.
Mm-hmm.
You can suggest anything to yourself,
mm-hmm.
but if there is some subconscious influence from past experience that's saying, no, don't go there. Guess who wins?